on to my favorite topic, or one of my favorite topics, which is complications. Now, whenever I start talking about complications with my patients, I always get that look. I thought implants are forever. Well, I'm here to tell you that they are not. There's a lot of things that can happen over time that can cause implants or implant components to fail over time. Now, what I want you to imagine is you have a 100-pound dumbbell in your hand and you have something that you're hammering over and over and over with that 100-pound dumbbell. What do you think is going to happen? At one point, you're going to break it. So this is exactly what happens in the mouth. And to kind of take it a step further, our bite on average has about 120 pounds of pressure. So imagine you're doing that not for a day or two or a week or a month, but for years, right? So that's something that at one point will cause things to break. And I want you to understand that. That's very important. Now, whenever I have this conversation, the first question, is, well, doctor, I have teeth. Why is that happening to my teeth? Well, the best thing about teeth, or one of the great things about teeth, is that they have these shock absorbing ligaments. And these ligaments help fight against that pressure. Now, even with having that, we still have teeth that break, believe it or not. So an implant doesn't have any of that. So all the pressure is right there without any shock absorbing capacity. So you see, failure is just a matter of time. So I want you to understand that concept very well. And that's why whenever we can save teeth, that's what we want to do. All right, great. Now, let's jump into talking about some of these complications that might come up. Now, initially, after any surgery, you have inflammation, swelling, bruising, pain, possible infections, and most of that we manage it with medications and some post-operative instructions that will help you kind of manage most of that. Now, after the surgery, an implant can have a lot of issues. One of them is the implant can fail, and we lose the implant. The implant comes out because of many reasons that cause that to happen. But the complication is we lose the implant. That can happen anywhere from a couple of days after the surgery all the way to 10 years down the line. But that's a complication that can happen where the implant can fail. Other complications that can happen, the denture or the teeth, temporary or the fixed, they can break as a whole or in parts. The teeth might chip, need to be repaired. The components that hold things together, might fail as well. And all that can happen at any point, okay? It's very important to understand this. All these intricate parts have, a great ability to kind of fight all that stress that happens in the mouth, but at some point, something will give. So that's very important to understand. Now, we also manage all these things by making sure that we have, two sets of these, teeth. So if something breaks, we have something that we can still wear, okay? And we send the other, component to the lab to get it fixed. So that's important to understand how we manage those situations. Now, there's situations that actually we have to start all over again, okay? So that's also very, very important to understand. I hope this discussion framed your mind to understand why when you go in and ask for warranties, nobody wants to give a warranty, okay? And that's mainly because of all these little moving parts that are out of our control. And they vary, believe it or not, from patient to patient. So that's very important to understand as well. Now, personally, I have a warranty on all my work, and I have another video that will discuss how that warranty looks like. So check it out.